Welcome to the agenda. I am Ajay Kaul. In this program today we will talk about the rapid rise of corona cases in India, with the country surpassing Russia as the third most affected country in the world after US and Brazil. India is witnessing a rapid rise in corona cases and has now attained the third position globally in terms of the tally. This is not a good sign. The prevailing situation gives rise to questions like whether the corona crisis is being handled properly. In the agenda today, we will try to get answers to such questions from esteemed doctors. We have with us Dr. Vinay Agarwal, former National President of Indian Medical Association, and Dr. Yash Gulati, Senior Consultant at the Apollo Hospital in Delhi. But before we seek their views, let's have a look at this small report.
India has overtaken Russia as the third worst hit country by coronavirus after the total number of cases crossed 6.9 lakh. 24,248 cases were reported in the last 24 hours, which is the steepest single-day rise. The fresh cases and deaths have pushed the total cases in the country to 6,97,413 and the death count to 19,693. Maharashtra remains the worst hit state in the country with 2,06,619 total cases, even as the state's government plans more relaxation. Chief Minister Uddhav Thackeray said a decision of the reopening of hotels and restaurants will be taken soon. The second in the list is Tamil Nadu with 1,11,151 cases. The total number of confirmed infections in the national capital Delhi stands at 556, away from the 1 lakh marks. The total cases now at 99,444, while active cases are at 25,038. Assam is also seeing a huge spike in COVID-19 cases, with the State Health Minister Himanta Biswa Sarma saying that now it is in the community. Sarma said Guwahati has formally entered into the pandemic situation now, and it is becoming bigger and bigger. The city is already under a strict 14-day lockdown since June 29, which will see minimum relaxation for 4 days from Monday, during which only standalone grocery shop across the city will be allowed to open from 11 a.m. to 4 p.m. Experts believe that the denser the number of the cases, the higher are the chances of community transmission. The Kerala government has also imposed a triple lockdown in the state capital, Thiruvananthapuram, from Monday for a week following a spike in the case of the coronavirus disease in the district. The announcement about the triple lockdown came hours after K. Surendran, the state's tourism minister, said the district was sitting on an active volcano. With the rising number of COVID-19 cases, Surendran had also said that there was no guarantee that there would be no community spread. Even as the cases are rapidly increasing in the country, the Ministry of Science and Technology, while referring to the approval for human clinical trials for two made in India COVID-19 candidates, Covaxin and Zycov-D, said that it is the beginning of the end for the novel coronavirus pandemic. The ministry's statement comes amid a row over a letter by the ICMR setting August 15, Independence Day, as the target for releasing a coronavirus vaccine. An earlier version of the letter had included a line saying that none of the 11 coronavirus vaccines undergoing human trials are likely to be ready for mass use before 2021. The line was deleted in an edited version of the letter released shortly afterwards. Medical experts and opposition parties claim the August 15 date was set up to help Prime Minister Narendra Modi score political points ahead of the crucial elections in Bihar later this year. They also warned that the rushing drugs through trials could pose a serious health risk. After this, on Saturday, the ICMR defended its letter and said it had only sought to cut unnecessary red tape without bypassing any necessary process in the recruitment of the participants for the trial. ICMR's process is exactly in accordance with globally accepted norms to fast track with vaccine development, the agency said. Besides the indigenously developed vaccines, the Science and Technology Ministry also said that manufacturers of two of the leading international candidates developing vaccine, British firms AstraZeneca and the US-based Moderna, has signed production agreements with the Indian companies. Should their vaccine prove safe and effective, both have been approved for phase 2 and 3 trials. Bureau Report.
So let's welcome Dr. Agarwal and Dr. Gulati to the program. Welcome, Doctor. So my first question is to Dr. Agarwal. So corona cases are increasing rapidly, and now the question is that whether this situation is being handled properly. What is your view on this?
See, I personally feel, Ajay, that if we go in the past and we go from 22nd March onward, definitely the situation was not handled properly. There was lockdown 1, lockdown 2, lockdown 1 and lockdown 2 were basically put in place so that we can prepare ourselves for the worst possible situation. We had an example of the Western countries. We had the European countries in front of us, and that is why lockdown was done so that the citizens will be able to acclimatize themselves in the new situation, and we are able to improve our infrastructure medically. Unfortunately, this did not happen. What happened was lockdown 1 and 2 devoted the entire time to the migratory labor class. They are arranging their food, arranging their stay, arranging their transport, and the disputes between the state and the central. Now, this entire thing, the total time of about 1.5 months was lost. And when cases started increasing, then the non-coordination between the state and central was so evident that we had the problems in even implementing the central resolutions or central directions which the states were supposed to take. I will give you many examples like that. You know, the total administration of and the management of COVID went in the hands of administrators. Administrators and then to the district administration, that is the DMs, who were practically not knowing anything about the medical field. They were not knowing the facilities around us. They were trying to save their skin. And that is why you saw the sealing of borders. Delhi persons will not go to Noida. Noida persons will not come. Even the medical personnel will not go. And the entire situation was so badly managed that, and if you see Delhi, now Delhi situation was worse. We had 60,000 beds in Delhi. Out of that 60,000 beds, you just imagine that 11,000 beds are with Delhi administration, 10,000 beds are with central government, and rest of them are private or even the semi-government agencies. Now, just imagine that up to the second lockdown, there was not even a trace of private sector's involvement in COVID management. They were talking about the public involvement. They were talking about the public hospitals. And Delhi administration kept out of 11,000, 5,000 beds for corona beds they fixed. You have seen the situation of corona beds in Delhi after third lockdown. I will not talk about it. You guys have yourself put that in place. They were not prepared. There was no management by the name. Now, suddenly their shift came to the 70% of the healthcare which was being provided by private sector. So they came to bigger corporate hospitals, asked them to fix some beds, and then when they fixed some beds, then again, the administrative decisions were so bad. Like one decision in Delhi which they took was bad in the time. 20% beds were kept in all nursing homes which were more than 50 beds.
So, Dr. Agarwal, what I understand from your views is that the lockdown was not properly utilized and the whole time was wasted. So, let me ask the same question to Dr. Gulati. Dr. Gulati, I will add one more question to it because there are questions about or maybe contesting views about the timing of the lockdown. Some people say it was hurried or some people say it was delayed. What is your view on this?
Well, number one, I must say that corona thing is a dynamic situation. It kept changing from day to day. People had to adjust. People had to give orders accordingly. We understand that. The timing of lockdown was a political decision. I am comment on that. As my dear friend Vinay said, the purpose purpose of lockdown was to prepare ourselves. The purpose was lockdown was never that we are going to eradicate COVID. It was not the purpose, because whatever disease had to happen, whatever spread had to happen, we knew it would happen. There was a mathematical model which said that July will be the peak, and that has turned out to be true. Also, we have been lucky to talk about the mortality has not been that bad. But I must say that
there has been so much of bureaucratic interference in this. There have been some ridiculous orders which were brought out. You know, like now somebody is saying that you have to put the vaccine by 50, because somebody in Delhi said that if a doctor gets infected, ask him explanation why he got infected, how he got infected, some kind of silly things, and you know, kept changing from time to time. And I'm afraid some politicians acted as politicians; they did not act as statesmen in a period of national crisis. What we need is today, as I have seen, we need statesmen, and also there has been so much of dichotomy between the state and center. We are dealing with a pandemic situation. So, what is this center thing, and what is the state subject? Since involved in this disease does not know any boundaries. So we needed one central structure to guide everybody in the country. Unfortunately, here even one district magistrate from Bulandshahr said different, and Noida said different, and Delhi people said different. They locked down one border and the other. So that has been very bad. That has been very bad. So even now we haven't. There is still time. And the most important thing which was to be done has not been done is training personnel. There's no point creating 10,000 beds when you have no one to man. You can have 1,000 aircraft and you don't have a pilot. What's the point? So we need to produce manpower. We need to train doctors for not respiratory physicians, but they are basic doctors to train them. We need to train more nurses. We need to train more paramedics. That is more important. Unfortunately, I can't see any courses that are being done anywhere in any hospital, anywhere in the country where you are training people in case we need them. How many people do we have who can run the ventilators in the country? But there are trained doctors, they can train. So right now the need is training and getting manpower and having one central agency which is guiding everybody, so that we are not wasting our resources. And politicians, please rise up and become statesmen for a change from now. That's what I think.
So, Dr. Gulati, you are also agreeing with Dr. Agarwal that the whole situation was not handled properly, and there was blame game between the center and the state, and the bureaucrats handled it. Shall I come back to you, Dr. Agarwal, on this?
Yes, please.
So, but Prime Minister of India says that we have saved lakhs of people because of the lockdown and other things. How do you agree with that perception?
See, the intentions of the Prime Minister and the central government has been excellent. I mean, I have no reason to doubt about their intentions. But I don't think they were able to percolate their messages properly into the states. Whether the fault lies at their end or fault lies at the state end, or whether it was totally political, I don't want to say that. But unfortunately, this is definitely there, that with the lockdown, you are maintaining social distancing. You are not coming in contact with anybody. So definitely rise of the cases was definitely decreased. But you can't keep lockdown forever. So that is why that lockdown has to be unlocked down. And that is because the economy and other things were terribly affected. So they have to release that lockdown this thing. And the moment this was released, our public probably took it totally in a strange way and a different way. You just imagine in Delhi, the first day of the lockdown, wine shops were open. Now, the opening of the wine shops, I don't find any reason to open the wine shop first. And the moment the wine shops were open, the decisions, once or two, that the total chaos was there, and they have to close it down. Now, that kind of administrative decisions are responsible today. What we are facing, 7 lakh cases, even increasing with 25,000 cases per day. That's gone more than 20,000. Now, this is what exactly is happening, and that is why, I mean, it is so unfortunate that we are racing with the globe and reaching to the third position.
So, shall we make out that the purpose of the lockdown was not actually met? Is it true?
Exactly. I will say so. I can say so.
Beds which were to be, or healthcare facilities for the COVID patients or symptomatic, asymptomatic patients are actually now the facilities are being prepared now, 1,000 beds and other things, which should have been done maybe during the lockdown, isn't it?
See,
Dr.
just
Gulati?
imagine when we have reached 5 lakh, more than 5 lakh cases. Now a 10,000 bedded facility is being erected now in 10 days. It is not a credit that we have erected it in 10 days. It is rather, I will say, why it was not done in the last 4 months. We were anticipating this. It was not that we never anticipated this rise. We anticipated this because we had the best possible healthcare in the countries which are having, where the situation was worse. US situation was worse. Europe, the situation was worse. So we were not even better, and we should have been expecting more cases than this. So that is what I am saying, that what we are doing today, and I can say, excellent. The moment the central government has pitched in even Delhi affair or even in Bombay affair, you could find a better coordination and you can find a better situation. Even this is happening today. So this also speaks about the lack of coordination between the states and the center, which was so evident.
So let me ask Dr. Gulati, how serious is this situation and what can we anticipate now? Now we have attained the third position in the world now.
I know. In fact, I would want to bring out 2 points here. One related to Corona, and
We keep forgetting. Now, for the last 3 months, we've been talking as though there is nothing, no other disease exists in this world except COVID. So please.
let's spare a thought for other people also. There are other people who are suffering. So first I'll answer your question about, and then I want to make a point about the non-corona. About the corona, I personally feel there are enough facilities the government has created. There are enough beds, there are enough ICUs, there is enough equipment. And coordination, as Vinay also just said, we need to have a coordination between the doctors, the so-called bureaucrats who are running the place, center and state. There has to be one direction. We cannot be running different directions, and we cannot be wasting our resources. So if we have coordination, we have no problem. There is enough of material available. And as I said earlier, we need to have trained people who will man these places. That's more important. We need to have good pilots for these aeroplanes you're creating. There's no point just letting them park there. So let's have courses, train people. I just, I was reading a news that in Bangalore, a hospital, the owner is requesting, begging that please give me personnel. They have beds, but they have no people to run the place. That is what is more important. Now, and I'm very optimistic about Corona situation. I think our peak is about to come or has come. It will go down, and I think it will come down sharply. This is what we feel talking to the experts. Now, please let's spare a thought about the non-COVID patients, patients who have fractures, patients who have heart disease, cancer care, heart problem, kidney problem. They are suffering, and unfortunately, some of your colleagues in media, some other channels have stolen some footage from some hospital of one particular thing, and they were shamed Amir Khan in showing off how bad the situation. It's not that bad. People are working hard. People are working in difficult circumstances. I will request such people to come and just work in the hospital one day and see how things are. And taking footage at one particular place, one particular time, does not do justice to the sacrifice and the hard work people are doing. So my request is, please, some people should not sensationalize these situations and understand what people are doing. So, and also I feel that the non-COVID area should be totally isolated. The principle of primus non nocere, as Hippocrates was said, that anybody who comes to the hospital should not be put to more harm than he has already. So we need to isolate non-COVID, and we need to reassure people that we have done that. Everything. And we cannot ignore, I know many fractures who are not getting treated. There are many heart people who are not getting. So we need to work on that aspect also. So these both sides we have to work. But I am optimistic to answer your question. And to summarize, I would like to say that this is going to come down. And also I would say there are enough facilities. We need more trained manpower, which we need to do. This is what I feel.
So let me ask Dr. Agarwal, as the numbers are rising rapidly, and we are now the third largest country with corona cases. But at the same time, there are views that enough testing is not being done. So there may be many more. So what is your view on this?
See, Ajay, I personally feel that testing has to be there. Few of the states are shirking from testing. They feel their numbers will increase. I mean, this phenomena you can see in some of the districts. That is why I said the corona management has gone to the district management. And the magistrates are looking at it that how can they increase their numbers. So for increasing their numbers, they have to decrease the corona numbers. And that is why they are trying to say that corona testing should not be there. Only testing should be done of those persons who are admitted. You have to certify that this is a probable case of corona. Now, these kind of instructions have been issued by our NCR DMs everywhere and others also. Now, this kind of situation has to stop. Ajay, one thing is very clear. There is a disease and there is a team which is known as doctors who have to treat us. Another phenomena which has to stop immediately is demoralizing medical profession. Now, everyone from the government to the district magistrates and the DMs and the administration. Now, on one side, the central government is showering flowers. On the other side, even including media, I will say, media and the administration and other district magistrates and even some RWS are demoralizing doctors. There are cases which have been filed against doctors. Doctors are not allowed to enter in the RWAs in their houses, right? Not only that, doctors are demeaned. Like Dr. Gulati is talking about a specific incident in a hospital. Now you just imagine, it has to be treated by 100 doctors have died, Ajay. 100 are on ventilators in various hospitals. 5,000 more healthcare workers in the country which are known, which have got infected by this. Still we are fighting. Now we need, the moral has to be, kept in place. Our moral has to be high. And this is what a role the central government today, the state government today, district administration, media, and all possible administration has to do. If we have to fight corona, we have to increase the morale of the force which is fighting corona. And that is what my request with folded hands, with media, with administration, with everyone. Give them all facilities, incentivize them, at least increase their morale, appreciate them. Under all circumstances, you just imagine, initially, they had no PPE kits, they had no protective gear. Did you see one strike in Delhi? No. Or anywhere in the country. They were all there, fighting for it. Not only that, even today, a doctor of the unit is died, but that unit is still serving. It is just like a front warriors who are fighting on Siachen or Kargil. They are fighting here in the hospital. So they have to be, incentivized. They have to be appreciated. That is what exactly is required.
Okay, let me ask Dr. Gulati is very optimistic about the situation. But at the same time, as we see numbers are rising and now the onus is on precaution by people. But
Exactly.
what is the role of the government?
See, the government can only do so much. The government's role is to provide facilities, to train manpower, to do health education. These are the things the government can do. And also, as Vinayji said, that why people should, hesitate in accepting numbers. It's not something that a DM has created. Why is it scared of saying that
It
there
will
are
reflect
X number of
badly on a
people?
state, no?
No, why? I mean, why? It's not that he has created it. And if you accept it and you do better, it will reflect better that you manage better. So I don't understand the psychology of not accepting the number. So, you have to accept the reality. As far as the recovery is concerned, and you
Okay,
said the precaution.
Dr. Gulati, we are running out of time. One last question to Dr. Agarwal. How hopeful are you about the vaccine which SCMR says that we'll be shortly bringing out?
See, I'm sure that what you are saying has already been contradicted, that it is not the August that vaccine is coming. Of course, vaccine will come. But the vaccines of diseases like COVID and others, they don't come overnight. They don't come in 1 month or 2 months. Even the drugs don't come like that. So it has to go for human trials repeatedly in various situations, in various controlled trials. So I don't expect that vaccine will come at least in 2020, but we can see early 2021 or the mid of 2021, then we'll see a vaccine. And the vaccine will be definitely a hope. But my request to you, to the citizens is that today the effort is to decrease the mortality. We have to do all possible things. We community spread is there. We may not be able to reduce the number, but we will be able to reduce the mortality. So let us all work together to see that the mortality, which is 3% today, should be 2% tomorrow. And
Okay,
that is what
let's all work together to reduce mortality. That's all we have time for. Thank you so much for participating in this debate. Thank you. That's all we have in the agenda today. We'll be back tomorrow with another interesting topic. Till then, goodbye and keep watching APN News.